Hi, my name is Afsaneh Razi and I'm a computer science PhD candidate at the University of Central Florida. I'm happy to present our work Instagram Data Donation, or IGDD, a case study on collecting ecologically valid social media data for the purpose of adolescent online risk detection. This is part of an NSF-funded project. A growing body of literature has studied social media platforms' benefits and negative effects on adolescents. However, the adolescent online safety literature suffers from reliance on self-reported data, which are prone to subjective assessments, recall, and biases. Literature reviews in this area have been criticizing automated online risk detection approaches for datasets that do not accurately represent young users and have heavily reliance on external annotators, with lack of first-person perspective when establishing the ground truth for training datasets. Therefore, they called researchers for a more human-centered approach to strengthen the validity of these datasets. To address the gaps within the literature, we designed a study to gather real-world digital trace data from adolescents based on human-centered design principles to create a robust training dataset and to establish ground truth labels that could be used for effective risk detection. The figure on the left side shows the main page of the website, including the eligibility criteria. On the right side, the main steps of the study are depicted. We developed a secured web-based system where participants could be filtered based on eligibility by a pre-survey. We carefully designed the study to only send parental consent and teen assent for participants between 13 to 18 years old and consent for participants 18 to 21 years old after participants pass the eligibility. After filling the consent form, youth will be asked to complete a Qualtrics survey of pre-validated psychological constructs related to mental health and online risk behavior. Then they will be asked to upload their Instagram data in our website and flag at least two unsafe direct conversations that made them or someone else feel uncomfortable or unsafe. In this study, we aim to understand different dimensions that are associated with social media experiences and online risks, such as sexual risks, mental health issues, and cyberbullying. We gathered pre-validated survey measures from psychology and online risk literature to understand these risk behaviors better. For ensuring survey measures are high quality, we worked with clinical psychologists. The main goal is also to associate this survey data with their Instagram data to understand their real-world online social media interactions better. This figure illustrates the Instagram data donation system architecture. We leveraged several Amazon Web Services and other contemporary technologies to develop this system. After the online survey on Qualtrics, participants were asked to request a download of their Instagram data file in the form of JSON files. Once they received their Instagram data file, they were asked to upload the file in our system, which is then parsed and saved into our relational database. Next, youth are shown their direct message conversations in a user-friendly manner and asked to flag each conversation as safe or unsafe. Incorporating the perspectives of victims is crucial, as it enables the machine learning models to catch implicit inferences to the risk. Therefore, once participants uploaded their data, we presented their Instagram private message conversations in a sequential fashion, so they could review their interactions and flag each conversation as safe or unsafe, displayed on the left side figure. We allowed participants to self-assess the situations that felt risky to them, rather than limiting their responses to a predefined subset of risks. As shown in the middle, once participants flagged each conversation, they were asked to provide more details by first selecting a risk type and then a risk level for unsafe messages. On the right side, you can see that they were asked to provide more context for each conversation on why it made them or someone else feel uncomfortable or unsafe and the relationship between involved parties. Based on previous empirical studies, we realized the importance of understanding the context of each risk and the relationship between teens and the people who made them feel unsafe or uncomfortable. So far, 150 eligible participants completed the study. From those, we collected more than 26,000 conversations, which out of those, more than 2,000 conversations are unsafe. Total messages included in these conversations are over 5 million messages, which more than 2,000 of them are flagged by participants for risk types and levels. Most of the flagged messages were flagged as low risk level, rather than medium or high. On the right side, you can see a web administrative tool for overviewing participants. Due to the highly sensitive nature of the data being collected and the fact that this type of research has never done before, we overcame several challenges ranging from technical issues to ethical considerations that we share with the research community more in detail in our case study paper. In addition to the security and privacy and efficiency of the system, user experience was another critical focus of our system, as youth were the targeted users. Apart from obtaining IRB approval for the study, we adopted a series of measures to ensure that the participants were protected and the data gathering process proceeded in an ethical way. Concerns about child pornography and mandated child abuse reporting required detailed legal review, risk mitigation plan, contacting police, having NIH certificate of confidentiality, and clinician involvement in addition to the IRB approval. Our work embodies a foundation to online risk detection by curating a human-centered, ecologically valid dataset. The self-reported annotation of youth who have been exposed to online risk shines a light on the perspective of the victims. It should be noted that dealing with such sensitive data is accompanied with various challenges that researchers should carefully address. Privacy protection and ethical usage of private data, including the transparency and interpretability of the results, should be the utmost priority. Because of the sensitivity of the dataset, we are unable to share it publicly. However, we are willing to collaborate and share part of the dataset with researchers from accredited institutions. We created an open source community called MoveSafely that leverages evidence-based research, data, and artificial intelligence to help youth and young adults engage more safely online for interested contributors. Please check out the paper for more details and let us know if you have any questions. Thank you for listening.